Welcome to today's presentation on principles of trauma-informed care in nursing. We will explore how a trauma-sensitive approach can profoundly enhance patient care. Trauma-informed care is an approach that emphasizes understanding, recognizing, and responding to the effects of trauma, which is increasingly relevant in today's healthcare settings. We will then delve into how TIC principles are applied across various nursing specialties, including psych, ER, primary care settings, and examine real world examples that showcase trauma informed care's effectiveness. Trauma informed care represents a significant shift in nursing practice, focusing on understanding and addressing the persuasive effects of trauma on patients. TIC is grounded in principles that aim to create a supportive and empathetic environment, which acknowledges the widespread prevalence of trauma and its impact on health and behavior. Historically, healthcare systems have often operated without considering trauma's influence on patient experiences, which led to the evolution of TIC as a response to this gap. By prioritizing safety, trust, and empowerment, TIC ensures that care is both sensitive and responsive to trauma, thereby enhancing overall patient well-being and engagement. This approach not only improves patient outcomes, but also aligns with contemporary nursing practices that emphasize holistic and patient-centered care. Trauma-informed care is increasingly recognized as a transformative approach across various nursing specialties, including psych, ER, and primary care settings. The integration of TIC principles within these diverse areas underscores TIC's adaptability and effectiveness in addressing the needs of patients who have experienced trauma. The impact of TIC on patient outcomes is substantial, as evidenced by improvements in patient engagement, patient satisfaction, patient compliance, and recovery rates. When care is delivered through a trauma-informed lens, patients are more likely to actively participate in their own treatment, adhere to medical recommendations, and experience greater overall satisfaction with their medical care. This enhanced engagement stems from a sense of safety and respect, which is crucial for effective treatment and recovery. By incorporating TIC principles, healthcare providers can achieve more positive health outcomes and build stronger, more collaborative relationship with patients, ultimately leading to a more effective and compassionate healthcare system. There are 5 principles of trauma-informed care. Safety is ensuring safety is a fundamental principle of TIC, encompassing both physical and emotional aspects of the patient environment. This involves creating a space where patients feel secure and free from harm or intimidation, which is essential for effective healing. Emotional safety is achieved by being sensitive to and respectful of patients' trauma histories, thereby fostering a sense of trust and security throughout the patient's care journey. Trustworthy and Trustworthiness and transparency. Building trust is central to TIC, which is established through clear and honest communication. Healthcare providers must be transparent about care processes, decisions, and expectations, ensuring that patients are fully informed and involved in their treatment plans. Consistent practices and reliable interactions further strengthen this trust, making it easier for patients to engage openly and participate actively in their own medical care. Peer support plays a crucial role in TIC by facilitating connections between patients and providers, as well as among patients themselves. Encouraging these relationships helps create a supportive community where individuals can share experiences and coping strategies. This network of support can significantly enhance the healing process and provide patients with a sense of belonging and understanding. TIC emphasizes the importance of empowering patients by promoting the patient's autonomy and involvement in care decisions. Allowing patients to have a say in their treatment fosters a sense of control and respect, which is vital for the patient's overall well being. By supporting patients' choices and preferences, healthcare providers help the patient feel valued and engaged in their recovery process. Collaboration and mutuality in TIC involves building a partnership between patients and caregivers, characterized by shared decision-making process and mutual respect. This approach ensures that care is delivered in a way that honors the patient's expertise about the patient's own experiences and needs. Such collaboration not only improves patient outcomes, but also enhances the therapeutic relationship, making care more effective and responsive. Trauma-informed care has been shown to significantly reduce re-traumatization and enhance patient satisfaction, according to a growing body of research. For example, clinical trials have demonstrated that when healthcare providers implement TIC principles, patients report feeling more understood and respected, which leads to a decrease in anxiety and distress during interactions. A notable study published in the Journal of Trauma and Dissociation found that TIC approaches in mental health settings led to a 40% reduction in patient reports of re-traumatization, illustrating the efficacy of such practices in improving therapeutic outcomes. These findings underscore the transformative impact of TIC on both the emotional well-being of patients and the quality of care the patients receive. To effectively implement trauma-informed care, several best practices are essential. Continuous professional development and trauma awareness is crucial, ensuring that healthcare providers remain updated on the latest trauma research and techniques. For instance, regular training sessions on trauma-specific interventions can equip staff with the skills needed to recognize and address trauma-related issues sensitively. Additionally, integrating trauma screening tools into clinical settings allow for early identification of trauma, facilitating timely and appropriate support. Tools like the ACE questionnaire can help clinicians assess patients' trauma histories. Equally important is the creation and enforcement of trauma-informed policies within organizations. A compelling case study on the implementation of TIC principles in an ER setting demonstrates the practical benefits of the approach. In the study by Arvidsson and Kagan, an emergency department integrated TIC principles such as creating a calming environment and training staff to recognize trauma responses, which led to notable improvements in patient satisfaction. The results revealed a significant enhancement in patient experiences, with individuals reported feeling more respected and understood during their emergency visits. This study underscores the value of applying TIC in high-pressure settings, showing that such practices not only support patient well-being, but also foster a more positive and effective clinical atmosphere. Another case study offers insightful evidence of the benefits of implementing TIC in inpatient psych settings. By adopting TIC approaches such as integrating trauma awareness into treatment plans and fostering a supportive environment, the psych unit was able to significantly improve therapeutic relationships between staff and patients. This enhancement in interpersonal dynamics led to a notable reduction in the use of restraints, demonstrating a more compassionate and effective approach to maintaining patient behavior. The study highlighted that when staff are trained to understand and respond to trauma, patients feel safer and more respected, which in turn facilitates better engagement in the patient treatment. Incorporating TIC into nursing practice has significant short term and long term implications. Adapting TIC principles involves modifying how nurses engage with patients, ensuring that interactions are grounded in empathy, safety, and respect. This transformation leads to the establishment of comprehensive practices that support both patients and staff, promoting a healthier and more supportive work environment. Integrating TIC into daily routines and organizational policies not only improves patient care, but also sustains a culture of compassion and self care within nursing teams, ultimately enhancing overall quality of care and staff well being. As the field of TIC continues to evolve, ongoing research is uncovering new insights and innovations that promise to enhance TIC's application across multiple settings. Emerging studies are exploring novel approaches to integrating TIC principles into different healthcare environments. This ongoing research holds the potential for broader implementation, extending TIC practices into new healthcare settings and global contexts where trauma impacts diverse populations. As the field progresses, these developments will play a crucial role in shaping a more inclusive and supportive approach to world class nursing care.